Hello, I'm Christine. I'm going to be doing a postpartum assessment. Knock, knock, knock. Come in. Hello, Scarlett. My name is Christine and I'm going to be your nurse for today. How are you feeling? Oh, good. And how is baby feeling? Are y'all getting some good bonding in? Doing some of that kangaroo love? Oh, good. All right, well, the reason that I'm asking you some of these questions is because it's time for your postpartum assessment. Now, anything that I do, I'm gonna let you know what I'm gonna do. Some things you're gonna help me with. I might have you sit up in bed, I might have you dangle your legs. That way I can get to some reflexes, but anything that I do, if you don't feel comfortable or you want, maybe it's just a little cold or you want another blanket, whatever the case is, you just let me know, okay? Okay, good. So the first thing that I'm going to do is I'm just going to go ahead and get a set of vital signs on you. We'll start with some blood pressure. I'm going to go ahead and wash my hands real quick. Have you already picked out a newborn outfit for when you baby and you leave the hospital? Oh, that's so cute. All right. And then I'm just gonna need a finger on the other side. Sorry about the reach. Okay, we're just gonna let that go for a second. A little bit of pressure. I'll make sure my stethoscope is nice and warm. I know there's nothing worse than a cold stethoscope on your sensitive skin. All right, so blood pressure looks great, 120/80. Looks like your oxygen saturation's at about a 98. I'm gonna do a manual pulse on you though, if that's okay. Let's go ahead and get this off you. All right. All right, so all that looks real good. Your pulse is at 82, so that's normal. We want between 60 and 100. And your respiratory rate is at about 18, and that's normal as well. Next, I'm just gonna do an oral temperature, so this just goes underneath your tongue. Open up, please. All right, 98.6. All that looks real good. All right, so the next thing I'm gonna do is I'm gonna listen to your lungs, your heart, your bowel sounds. So we'll start at the front and then I'll have you sit up and then I'll move to the back, okay? So for now, you're in perfect position. Is it okay if I open up your gown? Thank you. Okay. We'll start with the lungs, okay? All right, go ahead and take a deep breath in and exhale. One more time. Deep breath in and exhale. Good. Now I'm going to go ahead and listen to your heart. I'm going to listen to the aorta, pulmonic, Erb's point, tricuspid, and then the mitral. All right, all that looks good. I'm going to go ahead and listen to your tummy, okay? I'm going to start in the lower right quadrant. Okay. Moving over to the left. All right, your bowels sound normal. So now what I'm gonna do, I'm gonna go ahead and have you sit up for me. All right, and then I'll just kind of get in here from the back, all right? All right, deep breath in and exhale. Deep breath in and exhale. Very good. All right, I'm gonna take these off my ears. Now I'm just gonna assess for a little bit of kidney tenderness, okay? So I'm just gonna lightly tap on your kidneys. You tell me if you feel any pain, all right? We're gonna do the left side first. Any pain there? Good. Any pain there? Good. All right, I'm gonna go ahead and I'm gonna have you lay back down. All right, so now what we're gonna do, is we're gonna get to the meat and potatoes of the exam, all right? So I'm gonna start with your breasts. Is it okay if I open your gown up again? Thank you. Okay, so I'm gonna touch them, okay? I'll warm up my hands a little bit. I'm just kind of looking for anything that's lumpy or bumpy. I'm looking to see if there's any abnormal discharge out of the nipples, if they look dry and cracked or anything. How's baby latching, by the way? Oh, okay. Well, we can help you out with that. We have some lactation consultants that can come talk to you. Would that be helpful? Oh, good. Yeah. You want to exclusively breastfeed. Yeah, that's a great idea. All right, so your breasts seem normal. And there were no red flags or anything. I'm gonna leave this, kind of close it a little bit and open up the bottom. I'm gonna assess your uterus now, okay? So since you just had a baby, the top of that uterus should be at your belly button. Yep. And then I don't really feel your bladder, so you must have just used the restroom. Yeah, it feels good, right? That baby comes off your bladder and you're able to empty it. That was my favorite part. No, my favorite part was the baby, but you know. All right, I'm gonna go ahead and have you open your legs up for me a little bit. I'm gonna press one more time, okay? I'm just kind of seeing what kind of discharge you have. That discharge is called lochia. So I'm looking to assess the color. If there's an odor to it. Have you noticed an odor? Okay, good. And then the consistency looks bright red, so that's normal for just having a baby yesterday. So all that seems normal. Any clumps that are coming out? Any thing like that? No? Okay, good. Good. All right, so now what I want to do is I want to turn you to face the wall. I'm just gonna look. You had a vaginal birth, correct? Okay, good. So I'm gonna go ahead and just assess to see, look at your episiotomy if you have one. Just make sure that it's healing correctly, okay? All right, so yeah, just go ahead and turn and look at the wall. All right, good. So everything looks good. It looks like it was a level 2 episiotomy. So not too terribly deep and very painful, I'm sure. Yeah, but it looks like it's healing very well. I don't think you'll have any issues. The stitches are still in there, but like the doc said, those will dissolve in time. Do you have any questions about that? Okay, good. And I meant to tell you at any time, if you have any questions for me, you just go ahead and you ask, okay? All right. So sometimes when we have a baby, or actually sometimes when we're just in the hospital and we're laid up in bed for a little while and we just don't move as much as we would like to, sometimes blood clots can develop, and the main area that they're going to develop are in those legs. So I'm going to go ahead and before I touch your legs, you just let me know. Have you had any pain or tenderness, any kind of swelling, anything in your calves or lower extremities? No? Okay. I'm going to go ahead and touch them. If I touch a certain spot and it's tender, you just let me know, okay? All right. So the left one seems good. I don't feel any heat coming off it. I don't see any redness and angriness in there. I'm gonna go ahead and do the other one here. Okay, good. Yep, everything looks normal there. No redness, no heat, no masses or lumps. Now I wanna check your reflexes, so I'm gonna go ahead and have you swing your legs on over, okay? The edge of the bed. It's the easiest way to do this. All right, and I'm gonna get my reflex hammer here, and I'm just gonna assess your patella reflex, okay? All right, good, and this one? Okay, yep, that looks real good. Now your Achilles, okay? All right, now I'm gonna go ahead and assess the bottom of your feet. Sorry if I tickle you a little bit. All right, and now clonus there. Everything looks real good. I did notice on your abdomen, on your belly, that you had a line right there. That's called linea nigra. I think I said that right. Anyway, so just because that's just a pregnancy thing. So this will go away in time. You just give it time and it'll go away. I didn't see any stretch marks on your legs or your tummy, so that's, you don't have to worry about those fading away. So everything looks good. Your face looks nice and clear. Sometimes women will just get a little something on their face from pregnancy, but yours looks beautiful. You're glowing. You're a mom, huh? All right. I think that's all that I have for you. Let me just double check my notes real quick just to see if I forgot anything. I just want to make sure that you have the most thorough exam that you can have. Okay, just give me one moment, please. All right, so I think that physical wise, that's all that I have. I just have a couple education for you, just moving on forward. You said that you wanted to breastfeed exclusively, and so you know when you breastfeed you need about 500 more calories a day. So I really need you to make sure that it's very easy, especially with a newborn, to get caught up and not be able to eat properly. So maybe dad can go to the grocery store, make sure the fridge is packed with lots of healthy snacks and nutrients for you, because you're gonna need about 500 extra calories a day. You need to make sure you're eating some, good amount of protein, carbs, healthy carbs, those complex carbs, right? They break down a little bit slower and they're better for your body. They have more fiber, fresh fruits and fresh vegetables. And then also, if you like milk production wise, when I put that referral in for that lactation specialist to come talk to you, there's also certain foods that you can eat to help that breast milk come in and flow, which is always a good thing. So they have some tips for you on that one. I guess my last question, almost there, would be, have you been sweating at night? Have you noticed? Oh, you did. Oh, you soaked your sheets. Yeah. So that is completely normal. I don't want you to have to worry about that. That's just your body's way of getting rid of all that fluid that you had in your body. You know, when we're pregnant, the blood volume goes up. So you carry that, your ankles are puffy, whatever's towards the end of the pregnancy especially, everything kind of gets puffy, and that's just some fluid retention. But baby's out and your body has a natural way of just kind of letting that fluid go. So if that happens a couple more nights, then don't you worry about it. It's just perfectly normal reaction, okay? Did you have any questions on that? Okay. And other than that, I just want you to know that right now your hormones are probably up and down and up and down, and you may feel just happy, you may feel sad, you may feel angry. Those are all normal reactions. Your hormones have to level out now. They have been up because you're building baby, and now baby's out, so now your hormones are going to go back to normal. So it's completely normal to feel this way. If for some reason it's been a week, 2 weeks, 3 weeks, and you're just feeling super depressed and just not yourself, I mean, you could possibly have developed some baby blues, some postpartum blues, or if it goes even longer than that, it could be postpartum depression. And if something like that happens where you're not able to take care of yourself or baby, please reach out to us. We have resources. We have women that have gone through that, and it's nothing to be nothing that we haven't seen. It's not a new thing. So there's definitely support groups and ways that we can help you fight that until those hormones kind of regulate and get you back to you and taking care of baby, okay? All right, do you have any questions? All right, well, let me know if you need anything. And you have a wonderful day. Okay.